Thalassemia. It's a blood disorder that you probably never heard about. And you probably have it, but don't know that you do. You or your family or your friends. Joining me to discuss this blood disorder are Craig Butler, National Executive Director of Cooley's Anemia Foundation, and Priyanka Kumar, who is living with the disease. Craig and Priyanka, welcome to Brooklyn 45.
Thank you, Sam. It's good to be here.
Thank you. Good to be here as well.
Our viewers are anxious to hear from you. So let's begin. Briefly tell me, what is thalassemia?
Sure. So, as you mentioned, thalassemia is a blood disorder. It's a genetic blood disorder, which means it's something that a person is born with, not something that they catch. And when a person is born with a severe form of thalassemia, it means that there's a defect in their hemoglobin. And what that means is that their body isn't able to take oxygen around the way that it needs to. The blood doesn't carry the oxygen around, which is what you really need to have happen so that your body stays healthy and all parts of your body get the oxygen that they need. So without the ability to take the oxygen around, a person will develop a very severe anemia. And in this instance, it's an anemia which is not caused by iron deficiency, which is what a lot of anemias are caused by. It's just caused by the fact that your blood doesn't work the way that it's supposed to. And if there's not a way to address that anemia, a person will eventually pass away. So we're fortunate that the treatment for thalassemia is on the surface something that's very simple. The treatment for a severe case of thalassemia is a blood transfusion, but it's not just one blood transfusion. It's blood transfusions that you have to get your whole life, and it can be as often as every 2 weeks. So it's a very difficult disorder to manage. But we're very fortunate to have blood transfusions and a generally safe blood supply for our patients that are here in the United States. The problem is that that blood is great at making a person have the energy and the vitality that they need, to live a much more normal life. But all of that blood also comes with a lot of iron, and iron is a great thing. Everybody needs iron. But too much iron is a problem, mainly in this instance because the body doesn't have any way of just naturally getting rid of all of that iron. And if it can't get rid of it, the blood takes it around and drops it off in the heart or the liver or the pancreas or the thyroid or other organs, and it will accumulate there and eventually will destroy those organs. So it's a problem that we need to be able to take care of. And for many, many years, we didn't have a way of getting that iron out. Fortunately, back in the 70s, someone came up with what they call an iron chelator, and that's a drug which helps get out some of that excess iron. Now, the first chelator that they came up with, the first iron chelator, was a very difficult drug to take because you had to mix it up with kind of some sterile water and then attach it to a pump and take a needle and stick the needle from the pump into your thigh or into your stomach. And then you had to let that pump run for 8 to 12 hours every night. So it was a very difficult treatment for our patients to go through. We're very fortunate that in more recent years, they've developed what are called oral iron chelators, pills, basically, that you can take either as in pill form or you can dissolve it in water and drink it. And because of that and because of other things, we've seen a lot of advances in the treatment for people with thalassemia. So I mentioned that people that are born with a severe form have to have transfusions. And you may be wondering, well, what does that mean? So in order for a person to be born with a severe form of thalassemia, both of their parents have to have the trait for thalassemia. And that's where things can get a little bit difficult because if you are a trait carrier, you probably don't know it. The vast majority of people that carry thalassemia trait don't feel any different from anyone else in the population. They may feel a little more tired more easily sometimes, but it's not something that you can just tell yourself, oh, I must have thalassemia trait. So the only way to find out if you have thalassemia trait is to get a blood test. And most people have blood tests on file already, what's called a CBC, a complete blood count. And if you ask your doctor to look at a particular part of that CBC, something that's called the MCV for mean corpuscular volume, if you ask them to take a look at that, and if it is 80 or less, and you're not iron deficient, it means you're probably a thalassemia trait carrier, and then you would want to have further tests done to determine for sure if you are.
Who does this thalassemia disease impact the most and why?
Right. So thalassemia is something which developed not in America, but in another part of the world. So people whose heritage goes back to Italy, Greece, Northern Africa, the Middle East, South Asia, Southeast Asia, or China are more likely to to have thalassemia, to carry the trait, or to have a severe form of it. And the reason for that apparently is that, nature kind of has reasons for the way things that happen. And if someone has thalassemia trait, they have a less likely tendency to get malaria. And that part of the world that we talked about is a part where there is, or used to be, a lot of malaria. So the trait was kind of developed as nature's way of saying, here's a little protection. It's just that, unfortunately, if you have two people with the trait, then it could have a problem. It could result in a problem for their child being born with a severe form.
And most of our viewers are here in the United States and in Brooklyn.
Yes, absolutely. All those populations are so prevalent in New York City and in Brooklyn. I mean, that's where most of our population comes from in Brooklyn.
Many of us are familiar with sickle cell anemia. Why haven't we heard about this thalassemia?
Well, because it is rare, and that's great. We're happy that it's a rare disorder because we don't want everyone to have it. In the United States, there are probably only maybe 2,000 or 3,000 people that have a really severe form of it, and so that's why most people haven't heard of it. But there are well over 2 million carriers of the trait in the United States.
Wow. My research was wrong then. I thought there were just a few thousand. You were saying millions.
Of carriers, yes. If there are over 2 million trait carriers in the United States, and if you're someone whose heritage goes back to one of those countries that I mentioned, and that includes, by the way, the Caribbean, because so much of the Caribbean was also settled by people from those parts of the world. So we find often people that come from the Caribbean and don't necessarily strongly identify with one of the areas that I mentioned. They still may be trait carriers or may have thalassemia. It's the severe form of thalassemia.
So what are some of the symptoms of this thalassemia?
Well, it's the main symptom is the anemia that I mentioned, and what typically happens if you don't know that you've got the trait, if you don't know that your partner has got the trait, and you have a child, there's a 25% chance with each pregnancy that you will have a child with a severe form of thalassemia. But if you're not on the lookout for it, then you're not going to necessarily be looking for this. But what tends to happen is that a child is born to two people that carry the trait, and if they have a severe form, they're perfectly fine usually for the first 3 months or 6 months, and that's because during that time they're still having a lot of what's called fetal hemoglobin in their body, and over that 3 to 6 month period, we switch from having a lot of fetal hemoglobin to having what's called adult hemoglobin. And it's the adult hemoglobin that's affected by the thalassemia. So the child may be perfectly fine for the first few months, and then a person may notice all of a sudden, they're not as energetic as they used to be. They're more lethargic. Maybe they're fussier. And hopefully they'll take them to their doctor, and hopefully their doctor will know enough to say, I wonder if this might be thalassemia, and do a blood test, and hopefully we'll be able to diagnose it and get them started on treatment.
We have with us Priyanka Kumar, and she's a client of the Cooley's Anemia Foundation. Tell us about your story.
Well, my name is Priyanka Kumar and I live in Michigan. I was diagnosed with thalassemia when I was about 5 months old. Um, I have my dad is from India and my mom is from Guyana. And so both of my parents are the trait, hence why I have thalassemia. And my parents being foreigners, they had no idea. I was a baby who would probably drink one bottle of milk for how my mom explained it to me. And as Craig mentioned, I was lethargic, I was fussy, I wouldn't sleep, I wouldn't eat. And, being first time parents, my mom, she had mom's intuition, something is wrong. And so, next thing you know, I was being admitted to a hospital. And I was so grateful at the time. I was living in Queens, New York. And so, I had an incredible doctor who was able to diagnose me with thalassemia. And that's where my journey began. And today I am going to be 31 years old in June, and I receive blood transfusions every 3 to 4 weeks, depending on my hemoglobin. Sometimes I do run on the low side, and I get 2 units of blood. And as Craig had mentioned, I as well do chelation. Back in the day, as a 90s baby, I did have the pump, and I would have to get, injected, whether it was my stomach or my thighs, and it would run for 12 hours. And today, now I take oral chelation and I take two different kinds. And, my journey, it's still going, but I'm hanging in there. And I'm very thankful for everybody that donates blood and that I'm able to be here in the US and get blood transfusions.
Craig, you're shaking your head. Why are you shaking your head?
Oh, it's just such a familiar story, and because I know Priyanka, of course, which is great, and it's wonderful, to see how well Priyanka is doing and how well so many of our patients are doing now that there are good treatments available for them, and that it's such a difference from the way things were, 70 years ago when our foundation was founded, and there was still so much experimenting going on, and patients for transfusions tended to die when they were children. Maybe they'd make it into their teenage years, and even after the first bits of chelation started, we still had patients not really making it really much past their 30s or 40s. But now, because there have been so many advances, if a person gets the treatment that they need and is able to maintain it, they can live to their 50s, 60s, and even beyond. And we're thrilled that there has been so much of a change, and that we've got people like Priyanka who are just having wonderful lives that people didn't have back in the 50s or 60s.
Priyanka, do you have any children?
I do not as yet.
And Craig, what are the difficulties that these children, when Priyanka does get children, what will they experience?
Well, hopefully the children will have no problems at all. Most likely, if Priyanka has a child, they will be a trait carrier, because Priyanka does not have either of the genes on her end, being a person with a severe form of it. So they'll have a trait, and that's just something that they'll need to look out for. Mostly when you have the trait, it's important so that when you're thinking about having your own family, that you find out if your partner carries the trait, and then the two of you can decide together, what kind of things do we think are important in terms of having a child, and do we want to do testing to know whether our child is going to have thalassemia, or what kind of options do we want to carry on. But the children, and in fact, people with severe forms of thalassemia having children is a relatively recent phenomenon. It's only really been a common occurrence for about 20 years. Most of the time before that, it would be very rare for a person to have a child if they were a person with a severe form of thalassemia. But now again, because of the great advances, there's so much more that's being done. One of the problems that a lot of our patients still face is that in addition to the anemia that they have to deal with, there can be a lot of complications, particularly if you're not able to stick to your chelation. And sometimes it sounds like, well, what's the problem? You're just chelating, you're taking medicine. But It's really tricky because every person is different, and what works for Priyanka might not work the same way for another person. And so you have to have a doctor who knows, oh, okay, let's monitor this. Let's figure out how to get that iron out for each person. Because if they don't, they're going to develop heart issues or liver issues. A lot of our patients have growth and development issues or fertility and pregnancy issues. So it's really important that you have a doctor who knows what they're doing managing your care.
And tell us again, what are some of the symptoms of this disease?
So it's mostly the anemia itself. So really, actually, Priyanka, I'm sure you can talk about this.
Yeah.
What's it like, for example, when you get to the end of your couple of weeks cycle? How do you feel right before you have to get a transfusion?
Yeah, so actually, I'm going to be coming up on it here in the next 2 weeks. Usually very fatigued. I'm fatigued. I'm tired, lethargic. Just you feel drained, you know? You don't have as much energy. I'm a person who I don't know how to have any chill time. And so, I'm a person who is always moving and grooving and going here and there. And so you can notice with me, I start to slow down and I'm not as ready to, my feet on the ground and get going. I'm more slow moving. I feel tired. And as Craig mentioned, everybody is different. Somebody else with a different, thalassemia could be, in more pain versus not. So for me, when I get around my 3 week mark, I will get back pain and it will sometimes be in my lower back. It'll be in my jaw, the back of my head, my neck. And we experience that bone pain because of the bone marrow working extra hard. And so for me, I will tend to notice my body will hurt. I will be achy. I will be tired more than usual. And, for myself, I have to remember I need to slow down a little. So those are kind of my symptoms that I feel and, can be aware of, okay, it's time for me to slow down. It's, another transfusion coming up. And so those are kind of my symptoms.
Priyanka mentioned that she feels that back pain because of the bone marrow working, and that's one of the things that's really interesting about thalassemia. So blood is made in the bone marrow, and what happens with people with thalassemia is that the blood, it's not taking the oxygen around like it's supposed to, which I indicated, and the bone marrow starts thinking, oh, we're not getting enough oxygen. We need more blood. So it starts making more blood, thinking that that's going to solve the problem. And it's one of the reasons why they feel this bone pain is from the bone marrow just making more and more blood to try to compensate for the fact that there's not enough oxygen.
Yeah.
You said more and more blood. Are you talking about the red blood cells?
Red
What's
blood
red
cells,
blood
yes.
cells?
Yes, absolutely.
And it can be a very excruciating pain. It can be mild or it can be very painful.
But one of the side effects for a lot of our patients because of that and because of other factors is that they often develop low bone mass issues, kind of like osteoporosis.
Gross.
But instead of it happening when they're 50 or 60, it happens when they're 20 or 25 or 30.
So what kind of wellness goals should people set?
Priyanka, do you want to answer, or would you like for me to?
I feel like we kind of can tag team it. I'd say wellness goals, for people who are trying to figure out, the thalassemia journey, higher hemoglobin for sure. You don't want it to be low. Finding a specialist who can help you and is educated. We are our biggest advocacies. I can go to X, Y, and Z doctors, and they're not going to know your body. You have to advocate for yourself. So you have to, know your symptoms and be able to be aware and advocate and speak up. So I would say those are like wellness goals, and finding a good doctor that's going to listen to you and understand what's going on, your symptoms, you're not feeling good. I'm having bone pain or I'm lethargic. I have low energy. Those are, the symptoms to look for. But I would say those are some wellness goals. I don't know if you want to help me out here, Craig.
Sure, sure. So I think I mean, that's kind of it in a nutshell. But I think that one of the things is that a lot of our patients now, or a lot of people with thalassemia now, fortunately are able to kind of just set wellness goals of living a normal life, which they couldn't do some years ago. So they want to make sure that they're getting the blood, as Priyanka has mentioned. They want to make sure they're getting the blood. They want to make sure they're doing their chelation, but they also want to make sure that they're having comprehensive care evaluations every year. And that means going to a specialist who's going to be able to take a look and say, okay, we have to do these special MRIs, not regular MRIs, but very special targeted MRIs to find out how much iron you've got in your heart and how much iron you have in your liver, because that's something that's crucial. You want to make sure that your chelation is getting the iron out of the heart and liver as early as possible if it starts accumulating. So I think that's one of the big health goals. And I think one of the other things is really just to kind of find out what it is that you need to do to live as physically healthy as you can. A lot of the problems that we have with thalassemia is there's still a lot we don't know. We know that nutrition is very important for everybody, but we don't know enough about thalassemia to know how to get the kind of nutrients that we need, because people with thalassemia, they tend to have less zinc than they're supposed to. They tend to have less of some of the other minerals than they need. And it can be difficult to find ways to get all of that. You do supplements, but it doesn't work the same way that it does in a person without thalassemia. And I also think it's wonderful. We've had a lot of patients in recent years that have really started to be very physically active, like they wouldn't have been able to before, because they are living much better lives, and they can do athletic things. They can run in marathons if they need to. It's difficult, and they need some time to recover afterwards. But if there's someone who really wants to make that a goal, they can do that.
You talked about how it affects the heart and the liver. What about the kidneys?
The kidneys can be affected. They're more often affected not from the iron. It doesn't tend to accumulate there as often, but the way that the kidneys are affected is that diabetes can become a problem with thalassemia. And there are some of the chelation medicines, if you take too much of them, can cause some renal issues as well. So again, that's something that they want to monitor and find out. If that's happening, they may need to switch you to a different chelator. And if you are developing diabetes, they'll want to try to do something to stop that before it becomes a real serious issue.
Is there a certain time in one's life when this blood disease becomes an issue?
So for the people that are born with it, it really becomes an issue right, from birth. But the key is to make sure that you're getting the care that you need from someone who really knows thalassemia. If your doctor is not really well versed in it, they may have information that's not true anymore, and that can really delay your ability to thrive with thalassemia.
You talk about being born with it. What about catching this disease from someone?
Right. So can't do that. It's strictly a genetic disease, and that's something which people don't always understand. And I think that's sometimes a reason why it can be a little bit of a problem to tell someone you've got thalassemia. If they don't understand that it's just genetic, they may be afraid. They might be like, "Whoa, hold on there. Am I going to get sick?" And so kind of have to explain to someone, nope, that's not the way it works. You can't possibly get thalassemia from you if you're not born with it.
Now, can anyone get this disease, or is it mainly people from Italy and the Mediterranean, of course?
Right. So those areas that I mentioned are where it is most prevalent. But the thing is, there's particularly in America, you've had people coming over here for years and intermarrying. And, we know many people who have thalassemia who don't necessarily strongly identify with Italy, Greece, South Asia, Southeast Asia. So That's why we always encourage people. It's so easy to find out if you carry the trait. That's why we always encourage people, just find out.
Well, I'm a prime example. I mean, my dad is from India and my mom is from Guyana, and they both had the trait. They didn't have a clue, obviously. And so here I am with thalassemia.
And you're from Guyana in the Caribbean.
Yes, my mom. Yes.
Tell us a bit about the organization that you are with, the Cooley's Anemia Foundation.
Sure. So we're a nonprofit that was founded in 1954, and we only deal with thalassemia. One of the old names for thalassemia is Cooley's anemia, and that's because it's named after a Dr. Cooley, who was the first person to describe it in the medical literature. And we provide patient services. If someone's child is diagnosed with thalassemia, they call us, and we get them in touch with an expert and help them learn about what they need to do to ensure that their child is going to have a good and healthy life. And we also fund medical research, and we go on programs like this to try to educate people about it. Anything we can to help people that have thalassemia live better, stronger lives.
And this story is very timely because May 8th each year, I believe, is International Thalassemia Year.
That's right. So we celebrate the fact that our patients are living wonderful lives now on May 8th and do everything we can to spread awareness about it.
Well, we want to thank you for being on this program, Craig Butler.
Thank you.
And Priyanka Kumar. I got your name right,
Yep.
Yes.
Thank you. Yep.
And thank you for the information that you have shared. And people will be asking, do I have it? Or was it in my family? And is it being inherited? So how do people get in touch with you again?
They can contact us at, they can go to thalassemia, THALASSEMIA.org, or contact us at info@thalassemia.org, and that's usually the easiest way.
Okay. Priyanka and Craig, thank you for being on Brooklyn 45 and the information that you have shared.
Thank you for letting us be on.
Thank you.
Again, Craig Butler and Priyanka Kumar. And we want to thank you, our viewers, for watching this program. We invite you to partner with Brooklyn 45. You can do this in so many ways. We are a 501c3 community television program. And when you support us with a donation, you benefit and our communities benefit from what we discuss. Please tell your family, your friends, and work colleagues to watch Brooklyn 45 programs on cable television and on YouTube. On behalf of our Brooklyn 45 team, I'm Sam Taitt.
Brooklyn 45 is a 501c3 not-for-profit, and we welcome your support. Check out our website, brooklyn45.com, and feel free to donate or share it with your friends and family. Have any comments or questions? Send them to our Facebook, facebook.com/brooklyn45tv. If you have any questions or topics you think we should cover next, shoot me an email over at brooklyn45tv@gmail.com. Thank you again for watching.